Hi guys, my name is Matthew Sturck, and today I will be presenting on Crohn's disease. Now before I get into everything, I wanted to give a quick overview of what I'm actually going to be presenting on. So first I want to give a little bit of information on what Crohn's disease is, and I'm going to start referring to it as CRD. Next I'm going to get into the biological aspects of Crohn's disease. Then I'm going to get into the process of actually diagnosing the disease. Then I'm going to get into the epidemiological aspects of the disease, and then I'm going to start talking about the social determinants. So what is Crohn's disease? What is CRD? Well, Crohn's disease is one of two inflammatory bowel diseases that causes a bunch of swelling and irritation and inflammation among the gastrointestinal lining. The disease is chronic and often leads to decreases in quality of life of those it affects. And the Crohn's disease, like I said, can affect the gastrointestinal tract, specifically the small intestine, the large intestine, and the rectum. And before I get into more about the disease, I wanted to differentiate between Crohn's disease and ulcerative colitis, which is also another irritable bowel disease. So, Crohn's disease affects many areas, anywhere from the mouth to the anus, which includes the mouth, the esophagus, the stomach, the small intestine, the large intestine, the colon, the rectum, and the anus. Whereas ulcerative colitis only affects areas of the colon. And I wanted to make this distinguishment because Crohn's disease is a lot more severe than ulcerative colitis as an irritable bowel disease. Next, I wanted to get into the biology of the disease. So the actual causes of Crohn's disease isn't exactly known. However, they're believed to be genetic factors and environmental factors that can lead to the development and progression of the disease over time. For instance, there have been over 200 genes that have been found to be associated with Crohn's disease, most notably a mutation of the NOD2 gene, which is an intracellular pathogen recognition receptor. And the environmental factors that have been found to be associated with the development of Crohn's disease include smoking, living in highly polluted areas, so urban areas near the city, oral contraceptive use, antibiotic use, and the use of NSAIDs or non-steroidal anti-inflammatory drugs. And this infograph on the right shows the distinguishment between a healthy gut and an NOD2 associated Crohn's disease. Now, there are different distinguishments of the different types of Crohn's disease based on the areas that the disease actually affects. There's ileocolonic, and isolated upper. Now, many of these names actually discuss the areas that the disease actually affects. So for ileal, often referred to as ileitis, is a form of Crohn's disease that affects the ileum. Colonic is a form of Crohn's disease that actually affects the colon. And ileocolonic is a form of Crohn's disease that affects both the terminal ileum and the colon, whereas isolated upper Crohn's disease is a form of Crohn's disease that affects the stomach and or the duodenum without affecting the small or large intestines. And on the right, you can actually see where specifically in the bowel that these specific Crohn's disease variants affect the bowel. Now, concerning the phenotypic effects of Crohn's disease, there's non-stricturing and non-penetrating complications. There's also stricturing and penetrating. Now, I mentioned non-stricturing and non-penetrating complications, but actually this is a form of Crohn's disease that doesn't result in complications over time. It's a form of Crohn's disease that doesn't result in excessive scarring and narrowing of the digestive tract. Whereas stricturing is a complication that results from Crohn's disease in which the intestine begins to scar and then scar tissue begins to build up, and as a result of that building up, the intestine begins to narrow, causing blockages, and this can be seen on the image on the right. And then there's penetrating Crohn's disease, in which a complication arises from Crohn's disease in which inflammation extends beyond the bowel wall, forming fistulas and abscesses. Now, you might be asking, what's a fistula? What's an abscess? Well, a fistula is an abnormal connection that's not supposed to exist in the body between two different body parts. So there could be a fistula or a tunnel between the large intestine and the skin, and that would allow for fecal matter to honestly be exposed to the outside of your body. And then there are abscesses, which is a collection of pus that forms within body tissues, organs, and cavities, and that can lead to many other complications down the line. Now, to drive in the point of how severe Crohn's disease is, I have a list of symptoms of Crohn's disease, and I want to go through each one just to drive how severe it is. So, symptoms can range from diarrhea to fever, fatigue, abdominal pain, cramping, and then more excessively, blood in the stool, mouth sores, reduced appetite, rapid weight loss, pain or drainage near the anus resulting from fistulas, as I had discussed earlier, inflammation of the skin, eyes, joints, liver, and bile ducts, kidney stones, anemia, and delayed growth or sexual development within adolescence. And you can see that in this infographic right here, it explains different symptoms of the disease itself. Now, based off symptoms that patients present as a result of Crohn's disease, physicians need to make a diagnosis. And how do they make these diagnoses? Well, there's blood tests and stool tests. Now, many of you are familiar with blood tests, but I want to go through blood tests as in it's a way to analyze the blood for signs of anemia, which is another symptom of Crohn's disease, and infection to determine if abnormal inflammation is occurring. However, stool tests can also be used to further determine whether or not a person has Crohn's disease, in which you test the stool for blood or infectious microorganisms, including bacteria or parasites. If bacteria or parasites are in the stool, that can be a marker for whether or not a patient might actually be developing or have Crohn's disease. And stool tests can also be symptom specific, as in you can test for blood in the stool, another symptom of Crohn's disease, or chronic bouts of diarrhea. And checking the stool is a great way to check for inflammatory markers such as calprotectin. And calprotectin is a great marker for Crohn's disease. There's also additional testing that you can do to actually determine whether or not a person has Crohn's disease, including colonoscopy, a CT scan, an MR enterography, and a capsule endoscopy. Now, colonoscopy, many of you are familiar with, but it's a procedure in which a camera at the end of a flexible tube is used to examine the colon to the end of the ileum, allowing the physicians to actually check to see if there's inflammation occurring. And a CT scan is an X-ray technique in which physicians can analyze the bowel and tissue surrounding the bowel. So from the outside, a physician can actually tell if a person is experiencing inflammation resulting from Crohn's disease. And then MR enterography is a type of MRI that is utilized with contrast fluid to evaluate fistulas around the small intestine and anus. And I actually want to drive in the point about capsule endoscopy and how important it is to actually diagnose a person with Crohn's disease using this method. And it's a test requiring a patient to swallow a capsule containing a camera. The camera will take pictures of the small intestine and send those pictures to a recorder, which is worn on a belt. The recording can then be downloaded and analyzed on a computer to check for signs of Crohn's disease. Next, I want to discuss the epidemiological aspects of Crohn's disease. And here we have an image of the incidence per 100,000 people of Crohn's disease within certain countries of the world. So in North America, Australia, Italy, Finland, Norway, and the UK, we have an incidence of 6.38 individuals per 100,000, whereas other countries typically have a lower incidence rate. Why is this? Well, it's thought that having access to fast food, living in highly industrialized areas, many of these factors actually contribute to the development of Crohn's disease. And as you can see in these countries that are also highly modernized, industrialized areas, we have higher incidence rates in comparison to other countries. Other studies have done research into the prevalence and incidence of Crohn's disease around the world. For instance, North America and Western Europe have a prevalence of about 100 to 300 people per 100,000, whereas they have an incidence of 3 to 20 cases per 100,000. Whereas Oceania, similar to that map, has a peak incidence of 29.3 per 100,000. And the highest prevalence in Europe is within Germany, which is 322 per 100,000 individuals to be diagnosed with Crohn's disease. But Crohn's disease is not fatal, but can cause complications that affect life expectancy, complications that we discussed earlier, which can include disease severity, age of diagnosis, and treatment. And Crohn's disease can begin at any age, and people are diagnosed from all ages, from adolescence to adulthood. And risk factors of the disease include family history, ethnic background, including people of Eastern European descent who have an increased likelihood of actually developing Crohn's disease as compared to the rest of the world, smoking, medications such as NSAIDs, which are non-steroidal anti-inflammatory drugs, high-fat diets, living in highly industrialized countries such as North America and Western European countries, and some parts of Asia and South America. Now, I would like to get into the social determinants of Crohn's disease. Concerning the increased risk of developing Crohn's disease, the incidence of inflammatory bowel diseases, including ulcerative colitis and Crohn's disease, is rising in racial and ethnic minority groups in the US. But why would this be? This is due to socioeconomic, racial, and ethnic disparities in irritable bowel diseases are increasing. This means that poor access to healthcare among racial and ethnic minority groups can actually lead to these increasing disparities. And social determinant factors can include economic stability, education, social and community context, as well as access to healthcare. And many of these people don't actually have access to healthcare, which can result in the increasing incidence of Crohn's disease among these people. As I said earlier, people of Eastern European descent have an increased risk for developing Crohn's disease. Why? Well, the exact cause isn't actually known, but it is thought to be highly genetic and less funding of healthcare systems within Eastern European countries such as Hungary and Croatia. And this decrease in funding of healthcare systems is actually causing many of the public healthcare systems to become private to allow for that funding to come back into those healthcare systems. However, that makes healthcare less affordable for people living in those countries and allows for doctors to move away from the Eastern European countries into the Western European countries, which causes more disparity, which allows for increases in the diagnosis of Crohn's disease among Eastern European citizens. And much of the data shows an alarming increase of incidence because of many disparities occurring in Eastern European countries. This is my works cited, and thank you for listening.